Then Dr. Sarah Thomsen, who is a lead policy specialist on health and sexual and reproductive health and rights in the Swedish Agency for International Cooperation. Then we will have a presentation by Natalia Linou, who is a deputy director of the HIV and Health Group in UNDP. Then Dr. Diarmid Campbell-Lendrum will provide a presentation on WHO's behalf. And then we will be hearing from countries on their experiences in integrating health within their NDC. First, we will have Dr. Agnes Soares da Silva, who is the Director of Environmental Health Surveillance and Worker Health at the Ministry of Health Brazil. And then we will have Dr. Misganaw Tewachew from the climate change, who is the focal point for climate change and health at the Ministry of Health Ethiopia. Without further ado, I think we can already give the floor to Dr. Maria Neira, our champion on climate change and health. Maria, over to you.
Thank you very much, Elena, and hello, everyone. Good morning or afternoon or evening, wherever you are. What a pleasure to see so many people connecting to those webinars. And I really hope that you are enjoying the different webinars opportunities we've had until now, and you are still enjoying. And I can see that you are still engaged and interested in this. Happy to see very familiar names and faces, but happy as well to see people saying hello from Turkey, hello from Somalia, hello from different parts of the world. That is really very nice. And before I forget, big thanks to Alice and Natalia for joining us today and for all the support provided. Next year will be fundamental. All the years are now fundamental in climate change, no doubt, but next year is when we will have the new NDCs. And let me tell you an anecdote. Very recently, at one of the big meetings with ministers of health and high-level policy makers of the health and environment, I put a very provocative question to some of them, and I said, do you speak NDCs? And most of them react to say, of course, non-communicable diseases. And I said, no, it's not NCDs, it's NDCs. We, as the health community, we need to learn how to speak NDCs. We need to be very familiar with that. We need to understand why it's so important to have health very much incorporated into those NDCs. And for that, we need to have very clear scientific arguments and scientific evidence, but we need to dominate a little bit or be familiar with what NDCs means if you want to protect the health of your people and if you want to obtain health benefits from those NDCs. And if you want to convince your policymakers and your different ministers at the country level, you need to speak a very good NDCs language. And I hope that this is happening now. Most of the health community is getting familiar with what NDCs, the national determined contribution of a country, are, and how much we need to be part of that, and how much we need to influence the process. So here we are. I hope that this webinar will help on all of that, because it's really important. The NDCs are important to obviously achieve or trying to achieve the famous Paris Treaty. And you know that here in WHO, we used to say that the Paris Treaty is not an environmental treaty. It's probably one of the biggest, more potentially impactful health treaties that we've ever signed. Because if we put in place, if we really implement the Paris Treaty, I think most of us would stop our job, stop our work, because health benefits will be generated on a very strategic way and an impactful way. So there is very much here that we are negotiating, and that's why we need to be fully involved on all of that. The health benefits that we can obtain from good agricultural practices and sustainable food production at the country level are enormous and generating healthy diets. The health benefits we can obtain if our ministers of energy at the country level and the national determined contribution, they put practices about accelerating transition to clean sources of energy for us, the health community. This will mean reducing dramatically air pollution. And as you know, this means reducing the 7 million deaths we are having every year. That's why we collaborate very much. We work very closely with the air pollution agenda, air pollution and health agenda. And of course, if they take measures and on their plans on the NDCs, we incorporate interventions on the sustainable transport at the city level, better urban design, green spaces in our cities. Now, climatic refuges, places where people can be and having a little bit of shadow and reducing this heat stress that we are facing in our cities. And of course, everything related to prevent heat weather streams and you know, that the Secretary General of UN is now giving a total priority to heat stress and heat waves. And again, health is very much affected, but it can be very much benefited. And we need to make sure that our health systems are resilient. Our, you know, our own health community is contributing to that, to bring in the health sector. We can do our own, but more than anything, I think we need to make sure that we are influencing in the good way the NDCs for next year. And for that, as I say, we need to be very fluent on this language. So I hope that this introductory remarks will keep you interested on what it will be discussed now and learning from those who will be presenting and hearing from you contributions, comments. Thanks, Agnes, as well for Agnes, not Agnes. I always call Agnes in French, but she's not French. She's Brazilian. So Agnes, thank you very much for being there. Natalia, Sarah, of course, Alice, and all of you. And thank you very much for supporting this and for what I'm sure you will be doing to make sure that the NDCs and health are very much on the agenda. Thank you. Back to you, Elena. Thank you very much.
Thanks so much, Maria, and thanks for this very energetic invitation to all of us to do everything we can to make sure that health is integrated into the NDCs. With this, I will give the floor to Dr. Alice Bell for her opening remarks. Alice, the floor is yours.
Hi, I will keep this brief because Maria said a lot of what I was going to say, but much more clearly. I love the idea of Paris as a health treaty. Of course, that's exactly what it is. One of my more niche hobbies is that I like to read about the history of climate science. I spent rather too much time looking at the history of climate policy and climate science. And when you look back on that, you can see moments where we've seen change happening very quickly and also very slowly, or not at all. Or sometimes we see, rather than progress, we see things going backwards. And it's not yet clear which of those moments this stage of NDCs that we're in at the moment, NDC 3.0 with our February deadline is going to be, are we going to look back on 2024 and 2025 and say, yes, that was another big moment. That was like another Paris moment. Or are we going to look back and say that was a missed opportunity or a real retrograde step? I think that that big health treaty in Paris, when we started thinking about NDCs, I remember it was about 10 years ago, I first wrote an explainer on what NDCs were. We were starting to have to understand what this new thing was so that we could prepare ourselves for it. But with the big, greater ambition that was set in Paris about thinking about, yes, we can keep to 1.5, we must, we should, we have to. That set us a big job. And it set us a job of ensuring that every single one of those NDCs moments was a moment of big change, that we would do everything we can to push faster, more impactful, better action with all of those moments. And I'm confident that it can still be. And I'm also sure that health will and has to play a huge role in that. At Wellcome, we see health as being pivotal to understanding and tackling the climate crisis, as I'm sure everyone else on this call does too. We can recognise and see the many ways in which health can power us to have fast, impactful, important moments like this. We know that it can help raise climate ambition. It helps us see the problem. It helps us see the problem for what it is. It helps us understand through understanding the impacts on the human body, the size of the problem, the shape of it, the scale of it. It does, for many people, give a kind of human face to it, but also even for those of us who don't necessarily need faces, but are more interested in technical detail, it gives us that technical detail that is that full picture of the climate crisis. It also showcases all of the wonderful things that can happen with climate action, that it's not just about all of the terrible things that are already happening because of climate impacts, but all the other things that can come with good climate action, cleaner air, all sorts of other health benefits and economic benefits, and just nicer things that you can do when you're also tackling climate change, the kind of win-wins that so often include health wins of climate action. We think it can also improve accountability, encouraging not just climate change to be seen as something that environment ministries and maybe some energy people get involved in, but it's something for the whole of government, for the health ministries, but also the many other ministries that think about health and worry about health in all of their work. Health, because it sits across so many things, is one of the things that can help climate sit across so many things. And I also think it's really vital that we remember that it also can support equity. I think this depends a bit on how we choose to mobilise health, and I think the WHO and Wellcome would both agree, as many of you would, that it is about health for all. You know, it's our approach to thinking about how we position health in climate policy at large has to be thinking about how we make healthier futures for everyone. One of the things that keeps me awake at night is not just that we don't act on climate change, but that action, the benefits of climate action are limited to just a small number of people, and a lot of those benefits are health benefits. So we need to make sure that they are available for all. But if we do this well, we will have more equitable, more just, fairer, better, more popular climate policies. So Wellcome really believes that climate change policy isn't just about the movement of carbon molecules or money on spreadsheets, but it is about making people's lives better. And health is going to be part of that. I am confident that this round of NDCs can be another one of those big moments. It has to be, it will be, and I think health can be at the core of that. And I really look forward to continuing this conversation with all of you and seeing what we do and what we learn and how we can prepare for the next big moment as we move forward to the February deadline. Thank you.
Thanks so much, Alice, and thanks so much for bringing the human face to the center of the climate change discussions and raising the ambition not only to countries, but basically calling on our all collective action to make sure that the next moment and the next update of the NDCs is really strengthening the integration of health. With this, I will invite Dr. Sarah Thomsen, the lead policy specialist, health and sexual and reproductive health and rights from SIDA. Sarah, the floor is yours.
Thank you so much, Elena, and thank you so much for inviting me to this really important session today. I'm so excited that you're doing it. I'm just going to say a few words about SIDA's ambition in this area, what we're doing now, and what we hope to see in the future. And just to remind you what SIDA is, we're the Swedish International Development Cooperation Agency. We're the Swedish government's agency for our development assistance. So in terms of our ambition, first, we definitely see a great potential to strengthen health in NDCs, both in terms of quality and ambition. And our own commitment to climate change and health comes from a systems perspective. And our operational strategy, which is determined by what the government tells us they want to work on, includes both a goal on improved health for the most vulnerable and a goal on expanded and efficient climate development assistance. And we've been doing considerable internal work in the last 2 to 3 years to ensure that we have synergies between these two strategy areas. And I work as the lead policy specialist in health and SRHR, work very closely with the lead policy specialist in climate, environment, and biodiversity. Some of the activities that we've done thus far to build internal capacity is a lot of learning, documentation of best practices on how our partners are integrating and working on climate change. Diarmid participated in a development talk that we had here in December. And then also developing tools for having dialogue with partners on climate integration in health programming. And so we've developed some tools around that. What are we doing now then? One is, in addition to Sweden's core support to WHO, SIDA gives co-financing to Maria's unit, the Unit for Environment, Climate Change and Health. And we do this very happily. We believe that WHO has a strategic and important role at the global level in highlighting health threats in relation to environment, climate change, and also actively participating in climate negotiations, but also in helping countries in transforming and ensuring sustainable and resilient health systems. I'd like to just spotlight on one of our ongoing country-based activities right now, which I think feeds into this session, which is our work on the National Adaptation Plan in Bangladesh. So on the request from the Bangladesh Ministry of Environment, Forestry and Climate, the embassy coordinated an effort by a group of development partners, bilateral, multilateral, NGOs, think tanks, youth representatives, to see how health considerations could be integrated into the NAP. And an objective was to provide recommendations to the government on how to address relevant health issues as part of adaptation investments in different operational sectors. And the recommendations from the development partners were then presented to both the Ministers of Environment, Forestry and Climate and Ministry of Health. In addition, the embassy organized a first policy dialogue on health and climate prior to COP28 in order to draw policy and strategy recommendations to the government delegation to COP28. And the embassy also co-financed a delegation from the Ministry of Health to COP28. And then a follow-up policy dialogue on health and climate will be organized in October as a pre-COP29 activity in support of the new interim government. So what do we want to see in the future? First, we want to make sure that all of our partners continue to advocate and hold governments accountable. We also want to see more collaboration between UNDP, WHO, and ministries of health at the country level. And then finally, as we all know, we need money, and the climate funds need to support the health sector. And in this regard, our partners need support in making the case for public and private investment in adaptation where health actions are highly relevant. Thank you.
Thank you very much, Sarah. And thanks so much for showcasing this specific example on how SIDA managed to strengthen this whole of government approach to make sure that all policies and programs are looking at health also at country level, and for supporting the delegation also to attend the COP. And of course, I think I speak also on Maria's behalf to thank SIDA for all the support that you are providing to the climate change and health team and the overall department. I see Maria nodding.
Good point, Elena, very much.
And with this, I think we can give, now we can move to the next session. And here we'll be hearing from Dr. Natalia Linou on the work that UNDP is doing on the NDC promise. Natalia, the floor is yours.
Thank you so much, Elena, and thank you, Maria, for your kind words. It's wonderful to see you, and it's really fantastic for UNDP to be joining the WHO in this important webinar. I have some slides that I think the colleague from WHO will be sharing for me. Thank you so much. So, you know, as Maria said, the year 2025 is the 10th anniversary of the Paris Agreement, the health agreement. And it marks a critical moment for our collective fight against climate change. I am optimistic, like Alice is, that this moment, we are embracing it as a health community, a climate community, to have more ambitious. But countries are expected to submit their revised nationally determined contributions that outline their sovereign commitment to climate action under the Paris Agreement. So this is NDC's third generation. So what is the climate promise? The UN Secretary General has underscored that ambitious NDCs are a key priority for the UN system, for all of us, and called on UNDP to use its existing infrastructure, its Climate Promise 1.0, to drive a coordinated UN system-wide support effort on NDCs, drawing on the technical expertise from across the system. So the goal is simple. We're going to work as a collective, all of the UN agencies, to support developing countries to align the third generation of NDCs to the 1.5 goal, to strengthen the quality and accelerate implementation of previous NDCs. Now, the approach at the country level, as you know, Sarah sort of alluded to, is a little bit more complicated, and that's what I'll speak a little bit to today. how do we move from a vision of alignment coordination to real implementation on the ground that is coordinated across agencies? And, some of the history, UNDP, for those of you who are more in the health space, UNDP has been doing this work. It's actually the largest, has the largest climate portfolio in the UN system, supporting climate action in 150 countries. But oftentimes health has been missing in historic work. It has been, climate adaptation and mitigation that touches on health, but often it's across other sectors, whether it's energy or buildings or agriculture. But increasingly over the last 5 to 10 years, there is realization that the climate and health agendas have to go hand in hand. And the goal is now to leverage the expertise and experience across the UN system so that the climate promise really delivers. So we are working with WHO on health across many settings and countries. We are working with the WMO on data and analytics and early warning systems for all, or the ILO on strengthening just transitions. And in all of those areas, of course, health is critical and WHO is critical. So let's move to the next slide. So at the country level, which is really where we need to see movement, the climate promise has 3 pillars. And the first pillar is basically around ambition. How do we ensure that the NDCs are ambitious, but also aligned with other processes, aligned to the Sustainable Development Goals? The 2030 deadline for those is real, and SDG 3 is going to be achieved hand in hand, in tandem with the climate goals. How do we ensure that there's political will and societal sort of uptake? And a key goal is to sort of link the public diplomacy and climate action at the national level and local levels with health. The second pillar is acceleration. We know that we are off track. And acceleration requires both a political commitment, but also a financial commitment, and ensuring that there's alignment across the public, private, international, and national finance instruments. We leverage innovative approaches. We integrate the technical support that many of you, and especially the WHO, have been developing. And the third one, which I want to spend an extra minute of, is inclusivity. The NDCs, to move from paper to action, need to really recognize and promote a human rights-based approach. We need to make sure that the most vulnerable, those who are being impacted by the climate crisis, are at the table. This means that women's groups, indigenous people, local communities, youth, and yes, climate stakeholders need to be at the table in deciding and shaping and co-developing the NDCs, because inclusivity is really the only way we're going to ensure that the way forward is an equitable. As Alice alluded to, unfortunately, there is a risk that climate actions that will benefit some are going to be taken up by wealthy countries, by wealthy communities within other countries, and leave people behind. And, the UN has this motto of leave no one behind. The climate crisis is a multiplier of inequities, and there's a real risk that many communities across the world will be left behind if inclusivity and equity is not centered in our response. And undermining all 3 pillars, of course, is finance. And, in a health and climate conversation, we may not get into the details, but UNDP thinks about financing of NDCs quite a lot. And the reason we do is that we have seen that, while there has been an increase in rhetoric on the climate and health nexus, the financial commitments are actually not as to the level that we have wanted them to be. So about 0.5% of multilateral climate funding goes to projects that have a health dimension. Air pollution, a top priority I know for Maria and for WHO, is getting very little international development funding. And so there has to be a push, and there is a push with ATTACH, with the co-investment facility that WHO and UNDP and GCF are working on together. There is a move to think about financing, but what we have seen in the past is NDCs that have climate goals or actions that are simply not funded. And that can't be the future. The future has to have both health integrated into NDCs, but also financial commitments, or at least at a minimum, a desire to connect the dots between the vision for climate and health action with a financing plan so that that can be realized. Let's move to the next slide. So today's conversation on the next slide, please. today's conversation, we're going to talk a lot about the analysis tools and guidance. And at the global and regional level, that's what we can do. So action, obviously NDCs are nationally determined. So they're going to be determined at the context at the local level. But there is a lot that we can do in terms of regional and global cooperation. We can ensure that there are tools, that there are guidelines, and WHO has such a plethora of that sort of information. Unfortunately, sometimes the people on the ground in a Ministry of Environment may simply not know about it or not know how to use those tools. So the capacity building and the analytical support that WHO is providing is critical. And I'm delighted that in many places we are doing this hand in hand. And advocacy and outreach is critical too. We need common narratives. We need to make sure that regional collective learning is happening, South-South learning is happening. And here I think that health is tremendously important for the advocacy and outreach. As Alice mentioned, as Maria mentioned, you know, the human face, the human dimension, being able to say what is at risk and also what is the potential benefit is able to change political decision-making. So potentially unfavorable political choices become favorable through a health lens. Next slide. Next slide, please. Yes, so the key dates, I don't need to go into detail, but I just wanted to show these to say that the urgency for action is now. We are already working on NDCs. At the country level, there's a lot of work happening with, you know, under the climate promise in terms of national mapping of what the UN will offer. So basically, we're looking at what are the needs, where doing some sort of taking stock of where we have fallen short. So countries that had NDC 1.0 or 2.0 may not have even met those goals and targets. So they need to know that before developing their 3.0. And coordination so that government and the UN system is aligned in their offer to sort of support. Obviously, we are now heading into the General Assembly. I am based in New York, and you know, next week is going to be a busy week with new commitments, and many of you, you know, and a lot of action we expect to happen in September. But of course, we're all looking to November and COP29 for support for you know, elaborating a little bit more and ensuring that health continues to be at the forefront like it was at COP28. February is the official deadline for the submissions, but we do expect that there will likely be some latecomers. September is the date, September 2025, when there will be a report, the synthesis report, and we expect countries to, you know, to be working until then. And of course, the 10th anniversary of the Paris Agreement, COP30 in Brazil. We hope we will be able to celebrate health truly being integrated in many, many NDCs in a way that is measurable, impactful. Next slide. So this is my final slide, and I don't need to go into a lot of detail, but UNDP has been thinking a lot about why are we trying to integrate health into the climate promise? You know, there are a lot of other actors. People are saying, you know, how are you integrating the rights of farmers or land rights? Like, why health? And I think critically, the result, you know, political engagement of the health community, ministries of health at the table, as well as health stakeholders, is so important because the health narrative, we truly believe, can raise ambitious and build the political support for action. If we can show, and I know that my colleagues from WHO will show in their next presentations, that the cost of action may be high. For example, some policies may be costly, but the health benefits far outweigh any of those costs, then we have a true rationale for moving. So the political engagement is critical. We also think that health being at the table will result in better quality NDCs. So we don't want just health being mentioned, but truly the tools that we have, the data that we have, the evidence can make the NDCs stronger and measurable. We can look at how, you know, is the NDC truly changing the lives of people? That is what we want. And that links to inclusivity and accountability that was referenced by Alice. You know, if we have the health sector and health civil society at the table, we can ensure that there's greater transparency, accountability, and ownership. And for me personally, where, you know, health equity is at stake, the inclusive and accountable lever is, are we ensuring that the future shapes a path for everyone in our communities, not those who are best off and who can figure out some, you know, adaptation, put on air conditioning or et cetera, but really serving everyone. And finally, the health sector being at the table can ensure that, you know, we have alignment of public, private, international, and national financing and that health activities are appropriately funded so that they are sustainable. So that was my last slide. You can stop sharing now. I am delighted to be part of this conversation. I'll be staying to the end to answer any questions, but really the message is the urgency is now. The health sector has so much to offer. WHO has the tools and guidance notes, and we are, as a collective, the UN, through the Climate Promise, going to be working together to support more ambitious NDCs. Thank you so much.
Thank you very much, Natalia, for this excellent presentation. I think it's clear now everybody sees the relevance of the climate promise and the role that UNDP can play, bringing together and helping WHO to bring together the ministries of health and the health representatives in designing and implementing the health component of the NDCs. With this, I think we can invite Dr. Diarmid Campbell-Lendrum to give the key presentation. Maria, you want to say something?
With your permission, just one thing. I love your presentation, Natalia, on the reasons why we need health from the NDCs. With your permission, I will add one, which is that everybody wants to hear something positive and engaging and motivating. And I think this is one of the reasons why we need to include health as well, because we need to tell people and empower people as well to feel part of this. And I think health is very motivating and positive. Over, thank you.
Thank you, Maria. I will add that because you're right. I think the ensuring that we have a positive message is really what will motivate people. Thank you, Maria.
Thanks to both. Now I think we can invite Diarmid. The floor is yours for the key presentation by WHO.
Thanks so much, Elena. I'll just do the usual thing. Check you can see me, hear me, see a slide.
Yeah.
Great, thanks. Well, I'll try and be quite fast. Much of what I was going to say has already been covered to some extent, but there are important points that I think that we would particularly like to underline from the WHO side. The first is that, as Maria was saying in her opening remarks, we talk mainly to people in the health sector. It's part of the comparative advantage that we bring from WHO is that we usually talk directly to ministries of health and to the wider health community. And part of our job as we see it is to ensure that they are aware of the key climate processes that the health sector should feel are their processes as well. So as Maria has said, we refer to the Paris Agreement as the greatest public health agreement of the century. And this is sort of the cheat slide for those who weren't able to answer Maria's question around what are NDCs. And it's just a reminder to those of us who come more from the health side about what the Paris Agreement actually agreed, which was that we should take collective action across all countries in order to stay below 2 degrees warming, ideally below 1.5 degrees warming. And these NDCs, the clue is in the name, they're nationally determined contributions. So they are the climate promise, to use UNDP's language, the promise that each country makes for the actions that each country will take in order to contribute to that collective goal. So that's why it's so important for us to engage at the national level to ensure that these NDCs are strong, they're ambitious, that they're accountable, so countries do what they say they're going to do. And from our point of view, that they also promote health for two reasons. One, because we think we're a health agency, we're a health constituency. We think health is incredibly important. But we also think that health is a positive argument to contribute to climate action that actually makes climate negotiators' jobs easier because they have health arguments, health numbers and health advocates behind them supporting stronger climate action. So countries have committed to these NDCs. They have also committed to long-term low emissions development strategies, which have a slightly longer time frame, but these are all country-driven processes. And just to underline that point, that this is not something that is being driven from the top down by the UN in order to have a legally binding agreement for everybody's action. It is the voluntary commitments that the countries make through their NDCs, taking into account their own individual national circumstances. You've heard this referred to as well. the initial nationally determined contributions were accompanied the Paris Agreement. These were updated in the end mainly in 2021 because of the delays caused by COVID. We now have the next update of the NDCs, and these will continue on a 5-year cycle. So it is really important that we act urgently to ensure that this round of NDCs is as strong as possible, including from a health point of view. But obviously climate change is also, it's urgent, but it's also a long game as well. So we need to ensure that we continue to ramp up the ambition and the action on the ground and the accountability through the different cycles of NDCs. So what do we think we would like to see in a healthy NDC? Obviously, climate change and health has many different connections, and we've explored many of them in the rest of this webinar series. The simplest way in which we try and describe this from the WHO point of view is to say there are 3 big things that need doing. The first is at the top of this slide, and it's the action within the formal health sector, within health systems, where we think it's important that health systems become more resilient to climate risks, and also, wherever possible, to ensure that they don't emit any more carbon than they need to. Because healthcare is now about 10% of the global economy, it's about 5% of global emissions. So it makes a difference what health does in terms of emissions. So that's one job. The second, in the bottom left-hand corner, is about ensuring that we act across all of the range of health impacts that climate change can cause. So that does include some actions within the health sector, but it also includes working with others from a public health point of view, for example, on the determinants of health, to ensure that we are also strengthening resilience against extreme events or against vector-borne diseases or against malnutrition, the health risks associated with migrant populations displaced by climate change, for example. And then the third one in the bottom right is the one we'd like to particularly highlight within this webinar. And the reason for that is that all parts of the economy need to decarbonize. And if we do that right through decisions, for example, in the energy sector, the food systems and agriculture, transport and so on, we can get really big health gains. In fact, health gains which have a value which is much larger than the cost of fixing the climate crisis. So we think this is where we bring a positive argument from the health side into climate action, and the NDCs are a really important vehicle for that. Just to emphasize again, for those of us more from the health side who may not necessarily be familiar with all of the different quite complex climate negotiations and processes, there are a range of national climate plans. So we're talking mainly about the NDCs, the nationally determined contributions. I've also referenced the LT-LEDs as well, but there are also national adaptation plans. And within those, we support the development of health national adaptation plans aligned with or within those NAPs. And we support that from WHO and working with other partners and with national governments through supporting vulnerability and adaptation assessments, assessing greenhouse gas emissions and working out ways to reduce that, but also particularly for this webinar on assessing and identifying opportunities to get health co-benefits of mitigation actions. So how well is the world doing in terms of integrating health within their NDCs? If we're all agreed this is a good thing to do. So we've reviewed this. We reviewed the initial nationally determined contributions for their health content, and then the last round of the NDCs. And the news, I would say, is somewhat encouraging. Most NDCs now include some reference to health, and that wasn't necessarily the case in the first round. So almost all of them appreciate that health is important, and most of them will reference health co-benefits of climate change mitigation, refer to health adaptation and resilience, and also climate finance, which you've also heard about. So that's good news. Sorry, slight mistake on the previous slide. Many of them highlight health co-benefits. It's not most, it's about 30% highlight the health co-benefits of climate change mitigation action. but that's a big increase on the first round. It's gone from about 10% to about 30%. In the last round, only about 1% of NDCs quantified those benefits. And we think the quantification is really important because the numbers are really big. They're really impressive. We can save a lot of lives, and we can help to use that as an argument to drive climate action. And we also see that countries are referencing health co-benefits across a range of sectors now, which we also think is a good thing because there are big health gains to be made across several of these, of the largest greenhouse gas emitting sectors. And just to give a couple of examples of where we worked on this in some detail, with support from the Wellcome Trust, in fact, over the last 5-year cycle, I'll just give a couple of examples where we gave quite a lot of detailed technical support to countries who wanted to integrate health into their NDCs. And the results are really quite impressive. So Pakistan, actually the Ministry of Environment approached us first to say they wanted to know the health implications of the changes that they were going to introduce in their energy sector, or they proposed to introduce, around shifting to cleaner technologies and also potentially putting a price on carbon. And through joint work with them, we were able to elucidate that we could save over 60,000 lives a year from air pollution through the interventions that Pakistan was proposing. So that put the Pakistan Ministry of Environment in a stronger position in order to advocate for the actions that they were trying to promote. A similar story when we worked with Colombia. Again, we were able to substantiate that a lot of lives would be saved by the actions that were being proposed under the NDC, and also to put a value on that. So a significant value, in fact, almost $2 billion a year, every year, that would be effectively gained through the health benefits of the actions that were described in the NDC. So that's more on the mitigation side. Many countries also include adaptation as well. So we also think this is a positive move, and particularly low and middle income countries will highlight the need for health adaptation and include it within their NDC. And in fact, it's now a solid majority of countries which will include adaptation actions or plans within their NDC. So all of this is very good progress. In order to move on even further than that, we want to make it as easy as possible for countries to integrate health in a positive way within their NDC. And we're just about to publish new guidance for integrating health into nationally determined contributions. So I won't list the aims of the guidance, you can read them there, but it is all about bringing this positive argument and showing countries what they should do and how they should do it to integrate health into the NDCs. We recognize that the job of climate negotiators and climate planners is a difficult one. They will have many constituencies coming to them wanting their issue, if you like, to be integrated into NDCs or LT-LEDs or other climate processes. So we don't want health to be an additional job for them. We want health to be a positive argument that actually makes their job easier. So the guidance that we are publishing follows the standard steps of the NDC, the main headings that go into an NDC, and it shows how health-specific issues and evidence can be integrated into each of those. So do look out for that guidance, which will be published shortly. In addition to making the case for why health should be in NDCs and taking people through the process and giving examples, we're also getting increasing evidence of specific actions that countries can propose. So this is new evidence that's been assembled by our unit at WHO within the last few months that shows that just through a very limited number of interventions that could be the kinds of things which could be included in an NDC, globally, we could save somewhere in the region of 2 million lives a year by scale up of known effective interventions that are also supportive of climate adaptation or mitigation. So we think we're starting to get quite a full picture, a full story, as well as the process to support countries. The last couple of slides I won't go into in detail because I'm about to hand over to my colleagues from the Air Quality and Energy Unit who are responsible for many of these tools. But WHO and partners have developed tools to assess the health gains that would come from interventions that are very important for climate, such as increasing the amount and the access to green urban space, urban land transport, actions in the energy sector in particular to improve ambient air quality, household air quality, and also access to household energy. So you'll be hearing a little bit more about them, and these tools are also accessible through our websites, and we'll be very pleased to provide links to these as well. The final slide that I have, the final comment I wanted to make, is that we know that there is increasing interest and buy-in from countries on this agenda. So many of you will be aware of the Alliance for Transformative Action on Climate and Health, established under the UK COP presidency in 2021, which now has 85 countries which have signed up to action to increase the climate resilience of their health systems, and also work towards decarbonisation of health systems, and also important determinants of health, such as nutrition. And we have over 70 development partners who are supporting those countries in order to do that, and now a very active community of practice and convening in order to collectively take that work forward. So with that, thank you very much for your attention, and I'll hand back to Elena.
Thank you very much, Diarmid, and thanks for depicting this positive trajectory in the integration of health within the NDCs, and also the good news that there are tools available, there is a forthcoming guidance by WHO, and basically there is a community of practice already established to support countries to better integrate health within their NDCs. With this, I will invite our colleague Pierpaolo Mudu, who is a Regional Technical Officer on Environment and Health in the WHO Regional Office for Europe. Pierpaolo, the floor.
Hello, everyone. Thanks for giving me the floor. And also, I really appreciate the presentation was done by Diarmid before, because my slides are really complementary, and I will develop a little bit more something that was mentioned before. Can you see my screen?
Not yet.
Yes, I can see your screen.
Okay.
Yes, I can see the screen.
Okay, very good. I'm going to do a presentation that is basically divided in a couple of different topics. One is a very brief introduction to the tools that Diarmid was quickly mentioning before, and then I will go a little bit more in detail on the work done on the NDCs. So let me see if I can scroll down here. Okay, so first let's move to the famous tools that Diarmid was describing before. This is a picture of what our unit and with our colleagues and with the help of many scientists we are working on. Some of these software are available since even more than 2 decades. Others are relatively new. They are all in common the factor of air pollution. So, for example, there is RQ Plus that works on the general impacts of air pollution, and while we have, for example, BARHAP that works on the household air pollution at country level. Then we have tools that work for land use, green spaces in particular, and then for mobility also we have a line of work on transport and soft mobility. But what you are interested more is probably the climate mitigation, air quality and health tool that I will go now in a second. What is important to keep in your mind is the fact that all this work that we have been doing on air pollution as a kind of multi-scalar background, in the sense that we know that you have to tackle issues, that you have to address problems at very different levels, at very different scales. And for example, Climate Cage or BARHAP, they work at the country level. HEAT or Green UR, they work at the city level. And the RQ Plus works at different scales from the neighborhood level until the global level. But this is very important now that we are discussing NDCs, because we are in a particular area of work. And the work that we do in our unit with our colleagues, as we are a technical agency, we have to follow very well the discussions on the methods. So we started from the methods that are behind the modeling the air pollutants that are related to NDCs. And from this discussion on the methods, we built basically a tool. And I'm not going to spend time on this slide, but this is an idea of the discussion that we have had with all the colleagues and all the scientists that have been working with us since more than 10 years on the development of this tool. And the first point that we had in mind was thinking about the emissions that are related to the major air pollutant that are related to the greenhouse gas interventions in the NDCs. And in order to model these emissions, we need to have source receptor matrices, and from there we can go in changes in air pollution at national and regional level. So I would say more continental level, if you wanna. And this allows calculations for health impacts and also economic assessment. Before Diarmid was presenting results for Colombia and Pakistan, I will go back on that very soon. So this is the methodology that we have been discussing years ago, and we have been refining until we were able to start producing a software. And the first version of this software was CarbonH, and the CarbonH was an Excel that has been available for almost 6 years, from 2017 to until 2023, and it was doing the calculation that I was describing in the model that you were exposed before. And a year ago, we managed to have online a new version of CarbonH, but the new version was very, very different from the previous one. Was very different because we have a very different user interface, and we have a different approach also on how to help people to do calculations. So basically, the ClimateH, the CarbonH is the same, is a calculation tool that allows the quantification of the physical, so the health and economic consequences that are achieved through improvements at the country level of air quality. And these are related to domestic carbon reductions reported in the NDCs. This is the web page where you can download ClimateH, and is available for Windows, or Macintosh, and for Linux. And this is the interface of ClimateH. For those that work in air pollution more regularly, you see that this interface is similar to the one of RQ+. RQ+ is one of the most used software in the world for the impact assessment of air pollution. And the success of RQ+, we thought that it was related to also to the easy graphical interface, and people are introduced to do calculations in a quite friendly environment. So we spent some time in order to have something similar for the health benefits of climate change policies. And so this is the result. And we have a manual for those interested in doing this kind of calculations. For example, the calculations that were presented before for Colombia are part of the manual. The manual has been developed with a lot of different scientists, and we have colleagues from the United States, University of Stanford. We had people at the GRC, at the European Commission, and in several countries that have been reviewing and supporting this work. I think I jump to the conclusions, and the first point is air pollution has a large impact on human health. But the most important thing is that you have to consider that reducing air pollution means also protecting the climate. And the other point that I want to stress is the fact that we are providing, WHO is providing tools that are simple to use to estimate adverse health risk and impacts of air pollution and air pollutants that are related to climate change. So thank you very much for your attention and interest in our work.
Thanks so much, Pierpaolo, and thanks for being fast because I know you had a lot more to share.
It's okay.
And you've been in this for many years. So much. I hope you can share tools and all the links in the chat because at least in the morning people were really interested in this work. With this, I think we can go directly to the country presentations. And first, I will invite Dr. Agnes Soares da Silva, Director of Environmental Health Surveillance and Workers' Health at the Ministry of Health Brazil. Agnes, please go ahead and tell us about the process followed in Brazil.
Good morning, good afternoon, everyone. Thank you for inviting me to participate in this webinar. I would like to share some slides. Let's see if I can do this. Okay, thanks. I think I'm going now to the practical part of this conversation. And I think it was really interesting looking at all the previous presenters. And I think it's very nice that WHO has this initiative to share information and also to have this moment of reflection. You know, we are all working in our own problems, and we think that nobody else has the same type of problems we have. So it's good to see that we have some support also. And I think and we have receiving some support, especially from Pierpaolo in the last period of we have been working. So it's really nice to be here and share what we've been doing in this process. What I'm going to present is a little bit of how we are thinking or how we are doing this work of having health in the context of the NDCs in Brazil. I think it's important to also share the information that for some time we didn't have climate change as a priority in the government, but this changed with the like we had the last time we had some mitigation and adaptation plans in Brazil. The last one that was worked with the health aspects of climate change was published in 2016. And then with all the political problems that Brazil has gone through, this work was basically not implemented. And what we've done is looked back at what had been done and what had been proposed. And it was a plan that was fit for the period. It was proposed, and basically it looked at some diseases that were sensitive to climate change, and some interventions to follow up and reduce the risks. What we did since then with the reinstallation of the Interministerial Climate Change Committee in June last year by the presidency of Brazil, it's quite different. It's a much bigger a process, and I would say also ambitious, and is led at the highest level possible. What it means, what we call the Plano Clima, it's a climate plan, is 2024 to 2035. It has some components, and how the health sector participates in all the components. It's a climate plan on mitigation, on adaptation, on governance and social participation, and the Brazil's climate ambition. Of course, we have different priorities, and for the health sector priorities adaptation. And I was thinking on this. Brazil has a big responsibility with the COP30, and to think that it has been 10 years of the Paris Agreement. I think we think on all the commitments done, and frequently something is forgotten, that is that was agreed, the common but differentiated responsibilities, and this has not been at all implemented, and sometimes we forget about this, that not everyone contributed at the same amount with the problem we are living in, but certainly the ones who at least had the least contribution are the ones suffering the most. And so is the case also in Brazil. And what I mean that we are part of this big plan, and we contribute to both mitigation and adaptation plans, but we do have different responsibilities. The main issues that we have been treating when building this plan is what we call the just transition, thinking on means of implementation, education, research, development, and innovation, and monitoring, management, evaluation, and transparency for all the cross-cutting strategies for climate action. And so how we do that? First, the Interministerial Committee oversees all the working groups, the technical working groups that is composed by different ministries. So in the adaptation plan, the National Adaptation Plan, there are 23 ministries involved, and there are 16 sectoral plans. Health is one of them. And for mitigation, 18 ministries that have 7 sectoral plans. And this means that when establishing the national determined contribution, if one reduces its ambition, the others have to cover for it. So it's always a negotiation, and it's always a planning together. You can have your sectoral plan, but in the end is a national plan that will organize what will be done in each sector. For us at the health sector, we also had some a more organized way of working. So we have a working group that is within the Ministry of Health, that includes all areas of work of the Ministry of Health, but also representatives of institutions such Fiocruz and Anvisa that are related to, and they contribute to, they're part of the Ministry of Health, but with the specific objectives, one more academic and the other on more on the control of whatever substance or medicines are approved to use in Brazil, and sanitary surveillance. But also representatives of the states. Brazil is a federation, so it's always a tripartite negotiation to implement any policies. And we have representatives from the states, but also from the council, from the municipalities, the secretaries of health from the municipalities and from the states. But also PAHO, WHO, is invited as not a member, but it's invited to participate in the process. We had already 2 technical and scientific workshops where we consulted with academics and designed the plan from the beginning. So the first was last year in October, the second last July, to already check if we had followed the what was agreed or what was suggested last year. We have moments for social participation, even in these technical scientific workshops. And we have moments of public consultation that are formally done on internet, but also on meetings with different stakeholders. So this is all done by institutionalized by the institutionalized part of the work, but this does not mean that it's only done in the working group. Of course, we have a situation that we have to look at what has been done by other areas, other sectors of the in Brazil. And one of them is there is this website that consolidates the information that we have. It's Adapta Brazil. And from here, for instance, we see that 90% of the municipalities were hit by some type of natural, I call it here, natural, not really natural, disaster between 2013 and 2022. And this shows clearly the distribution is not really equal. So there are some areas, in red areas are the mostly affected. But I must say that this current year has even made it worse, and it's not here in this map the terrible disaster we had with flooding in the south of Brazil, where most of the state was underwater. Here is the capacity, adaptive capacity, and we see also that a great part of the Brazilian cities or municipalities do not have a large capacity to adapt. And so why we need to look at it? We do that by looking where our health system is located, where all the basic health units and all the hospitals, all the different levels of the health systems are located, to also identify areas of priority areas that we have to work in our adaptation plan. And thinking that we have 6 different biomes, and the social demographic characteristics are very different. If you look at the south, north, northeast, and southwest of Brazil, and they have the baseline of what we expect from the health indicators are quite different, and this has to be considered when we make the plan, because our plan is based on health equity and climate justice. And we look very strongly at indigenous and traditional communities, and we take it seriously to give visibility to racial, ethnic, climate justice as well. So instead of working on diseases, we start looking at each problem and see how it affects, how could affect and is affecting the health, how its health impact on people, but also on health systems and on public health in general. And we are basically looking at health surveillance, healthcare, health promotion, health education, science, technology, innovation, and production as some for every single aspect that we are looking in our plan. This means, for instance, looking at Brazil produces vaccines, and not only vaccines, but some medicines, and is a huge I would say the largest buyer in the health systems, at least in the southern hemisphere. And this being public, we think we can also influence what has to be done. So this is basically what we've been doing, and we have this possibility of looking at details of in each part of how health affects how health is affected, but by all the direct and indirect influences from climate change. But this is done first looking at what we need to do to make the health system resilient, and then in conversation with other sectors, and we have periodic meetings to look at what needs to be done in other areas as well. I could give you an example, like for the elimination of use of solid fuels for cooking. It's an energy sector, but we participate in the discussion, so it's becoming a new policy. And some other areas, such as where to prioritize interventions to improve access to clean water and sanitation, or how to make it the transition, the just transition, considering the health aspects. For instance, it's very nice to have all these electric cars, but we need to look at what is happening at the communities where lithium is being extracted, or where the power plants to replace power plants based on any other fuel, if we are doing wind energy or solar energy, also how this will benefit the areas where large areas are being occupied with that. So it's looking at all aspects of equity. It's a very complex process with multiple consultations, even online consultations, on large meetings. There has been already a few meetings with the Ministry of Environment that is conducting the main process, and we are the Ministry of Health is always invited, and sometimes with thousands of people listening to what is being proposed, and thousands of people participating in proposing solutions or things that they want to see in this plan. I must say that the difficult part is that we are doing this work that is more to structure our interventions, but we are dealing with the emergencies at the same time. So we are adapting in a way what we are proposing based on things that we are living today. Now, for instance, we are we have a situation room that is working on climate emergencies. And yesterday, the president has called for this stronger governance at the national level on climate emergencies. And probably that's the new normal we are living in. So I think it helps as well to make the plan a little more ambitious, and maybe even Brazil, that has the energy matrix cleaner than most of the countries. We are now with 60% of our country covered by smoke from wildfires. Not really natural, I would say more on criminal side, but that's also a consequence of the drought we are living in, the high temperatures, and I would say even the Amazon, the rivers are now, it's so low that it's the lower we have seen in history since it has been measured. So that's the situation we are working on, and I hope you understood a little bit of how we are doing this contribution on health in the national adaptation plans. Thank you.
Thank you very much, Agnes. I think it's impressive all the work that you are doing at country level and the coordination mechanism that you've established, not only to coordinate with other ministers under the leadership of the Ministry of Environment, but also across levels at national, state, and municipality. It's amazing that you are already coordinating with other sectors, not only to define the targets for health systems, but also in other sectors like energy and also including considerations of equity. With this, I think we will move to the last presentation from countries. I will invite Dr. Misganaw Tewachew, who is the focal point for climate change and health at the Ministry of Health in Ethiopia, to give his presentation. Misganaw, the floor is yours.
Okay, thank you so much, Elena. Would you share the PowerPoint?
We can see the slides already. You can go ahead.
Okay, yeah, okay. So thank you so much. Yeah, so my name is Misganaw. Introduced. So as climate change health focal as the Minister of Ethiopia. So next slide. Next slide. Okay. So as an introduction, Ethiopia is prone to natural and human-made hazards like drought, flood, landslide, and conflict. And moreover, malaria, cholera, dengue, diarrhea, dengue, yellow fever, and chikungunya are some of the climate-sensitive diseases which are heightened by climate factors. And also, there is a weak and fragile socioeconomic and natural systems in Ethiopia, which are impacted by climate variability and change. And also, significant proportion of healthcare facilities in Ethiopia are inaccessible to the natural electric grid. In addition, some of the waste collected in healthcare facilities burned in incinerators, with old incinerators, which are emitter greenhouse gases mainly, carbon dioxide, and also trace amounts of nitrous oxide, methane, and other sulfur dioxide. So hence, to mitigate and to adapt these challenges, the country has developed various climate policy and strategies to respond to the climate impact in different sectors, in the health sector, and also the environment, water, and energy, and other sectors. So next slide. Next slide. So I have a weak internet connection, so please, yeah, okay. So when we come to the NDCs, so the Ethiopian NDC covered actions for health, and also other sectors include land use change and forestry. Oh, would you back the slide, please? Yeah, okay. So including their sector, and also other sectors include land use change, forestry, livestock, energy, waste, industry, water, transport, urban settlement, and also disaster risk reductions. So these lines the ministry has identified different adaptation mitigation interventions in order to build the climate. In this process, the MoH in the steering committee take requests, and we're part of this planning and development. So we are in part of this process. Yeah. So next slide. Okay. So as the NDC identified around 40 adaptation interventions. As part of this, the Ministry of Health identified around 5 adaptation interventions that are mentioned that have high priority areas. As mentioned before, the climate sensitivities and other natural and man-made affect the sector. So as shown in this figure, the reduce the malaria case incidence and also reduce cholera case incidence, increased proportion of households with improved toilets, and also increased proportion of households with safe water supply, increased proportion of healthcare facilities, safely managing healthcare waste. As mentioned before, especially the healthcare waste management in healthcare facilities is very poor, starting from the source up to, so we are working on this area. And also increased proportion of healthcare facilities with safe energy sources, especially the clean energy source, that is electricity and solar. So we're proposing different indicators, and also we are put a target.
I'm afraid we are losing the connection. I don't know if you can hear us, but the connection is breaking from our side, Misganaw. I think that we will give you 1 more minute to see whether the connection issues are solved. But if not, I would suggest that given the time that is quite late, maybe we can go directly to the closing. I see that there are lots of comments and questions very relevant in the chat. So the Secretariat will try to respond to all of those in coordination with the presenters. I think that the presentation by Ethiopia was very good because it gave also more details on how they managed to integrate health within the NDC, specifically looking at health targets for the population, for the health of the population and the health system and healthcare facilities overall. With this, I will invite then, we will share also the slides from Ethiopia, so you have all the details from the presentation. With this, I will invite Natalia, Linou, again from UNDP and Diarmid, to give very brief closing remarks from your side. Natalia, the floor is yours.
Thank you, Elena. And this is just a thank you, and thank you, Agnes, and also our colleague from Ethiopia for sharing in detail what it means on the ground and the challenges as well as the opportunities that lie in integrating health into the NDCs. From UNDP's side, we are ready to support any of you. I'll put in the chat my email address. And thank you again, Elena, for organizing this webinar and inviting the UNDP. Diarmid, over to you.
Diarmid, we cannot hear you. I don't know if you are connected. Okay, so then I will take the liberty to close the meeting on Diarmid's behalf. I think that as UNDP, basically, this is just to thank everybody for the amazing work, specifically probably more the countries for the work that they are leading and for sharing that with us. As UNDP, WHO stands ready to provide the technical support that countries may need to make sure that their NDCs integrate health in an ambitious way. And I think basically we have this collective responsibility to make sure that, as mentioned by Alice, we convert the next big moment into a health moment. So that's it from our side. Thanks everybody, and I think the meeting is closed. We will also leave our email address in case you want to get in contact with the village. Bye.
Yeah, bye.